going to start our recording. So good afternoon, everyone. Thank you for joining us for day 2 of our Love Data Week series. I'm pleased to introduce John Obi, who will discuss data collection, and health equity. Please leave any questions that you have in the chat, and when John is done with his presentation, we will go to the questions for a Q&A session. So without further ado, I'll turn it over to John.
Thank you. So I'm going to share my screen, and then we'll take it from there. Okay. Hi, everyone. So my name is John Obi, and I'm a data and analytics analyst coordinator. I'm a member of Craft team. And I work specifically, my location is at Student Health Wellness and Prevention Services Center, which is SHS building. And I'm also institutional representative researcher for ACHA, which is the American College Health Association. So today we're going to talk on the topic mainly focusing on data-driven insights from sexual health services survey. And we are leveraging the data analytics in order to improve sexual health services. So before we dive into that, I just want to show us this. I don't know if you can see my screen. So can you see the ACHA 2023 sexual survey? Perfect. So this is the survey we're actually going to review. This is a 2024 report of last year, a survey that concluded 2024. And our institution was part of the institution that that participated in this survey. And we collected data, different medical and diagnostic data, and we supported the survey as well. So I just want to, this is what we are going to go through, but I'm going to only pick on the main points and the trends from this survey. That's what we're going to look at. Okay, so what are we talking on today? Our topics are going to base on this introduction, the importance of data disaggregation, the trends in sexual health services, and outcomes of cervical cancer screening, the challenges in data collection with EHR, and actionable recommendations for equity. So I'm going to go a little faster, sweet, because we don't have much time to go more deep into every topic. But I believe we will touch a lot. So introduction. So as I told us, the ACHA, what it stands for. So the Student Health Services Survey provides comprehensive insights into the current landscape of sexual health services across US colleges and universities. So this survey collects data on clinical service provision and data disaggregation practices, such as cervical cancer, screening outcomes, trends of STI and HIV prevention. The survey aims to identify gaps that highlight successes and also inform strategies for improving sexual health equity. So our findings that we're going to present on our study today, on our presentation today, will help us to understand the key trends and actionable recommendations for advancing student health outcomes. So we have the importance of data disaggregation. So let's dive back. What is data disaggregation? Is the process of breaking down large data sets into smaller or more specific groups. So the keynotes that we can do, that is, that we should know that we can do a lot with data disaggregation, but we're going to only pinpoint what is actually needed in terms of health services. That's our focus today. So the key points here is that why do data disaggregation matter? The reason is because it helps us to identify gaps in equitable health services. And this, when we say identify gaps, it helps us in breaking down data into categories like age, gender, race, and sexual orientations. It also helps us it also helps health centers or hospitals or health centers to pinpoint disparities in services. For instance, treatment outcomes. So it helps them to identify groups that are most vulnerable. For example, we can say it can help us to like discover that certain groups are underrepresented in screening programs or that they face higher rates of specific health issues. So it also addresses disparities for diverse population, which is once again, once we identify all these gaps, it can help the health centers to target interventions that can be designed to improve access and health outcomes for diverse populations. So this helps ensure that healthcare services are equitable, inclusive, and responsive to the unique needs of all groups. So let's looking at this graph here. We can see that the bar chart compares data disaggregation. So it gives us that it shows us that data disaggregation capabilities from 2022 to 2023, there are significant improvements to gender identity in data collection. So as we can see here, data identity, there's a significant improve here in that, and also in data collection, it increases it gives us like from 60 to 80, like about 21% increase, as we can also see here. So it's highlighted. So similar positive trends are also seen in race and ethnicity and sexual orientation, reflecting growing efforts in data equity. So let's also look at this, the trends in sexual health services. So the key trends to identify in this report is basically high availability of STI, and HIV screening, which is about 90 a little bit above 90%. And pregnancy testing is also a little bit close to 100%, which is very good among the participated institutions as well. So let me just point out that the institutions that joined us, that our institution was part of in conducting this survey, was about 100 and a little close to 150 institutions. So that did this, that participated in this survey. So the previous one was a little bit above 200 institutions across the nation. But this one that we are studying the data now is about a little bit close to 150 institutions. So it also helps us in the trends based on this survey. We also understood that PrEP, there were about a little bit above 60% of institutions that offer these medications. And these medications helps prevent HIV infections in high risk populations. So, and having about 60%, although it's fairly, but not really perfect. Also in PrEP, we also have, based on the institutions that that participated in this survey, we have availability of about a little bit above 50% of institutions that have PrEP availability in their institutions. So this is vital for emergency HIV prevention after potential exposure. So also, we also see some kind, in terms of HPV HPV vaccination, we have about 59%, despite the importance of prevention of preventing cervical and other types of cancers linked to HPV. We only have about 54% that has this needed vaccine available in their institution. So, however, the positive note is that the steady increase in the provisions of PrEP and PEP since 2015, there's an increase in it, so which is good. I would say pretty good, indicating that there's a growing awareness of improved access over time. And also, let's just take a look at the graph here. Looking at this visual, this line graph, we can see that there are steady increase in PrEP and PEP provisions here. If you can see, there are steady increase here in PrEP and PEP provisions from 2015 to 2023. And while both services have grown, PrEP has seen slightly higher adoption rate, indicating which is growing awareness of HIV prevention strategies. So also, we can also see in the bar chart here, this compares the percentage of institutions that offer these key services. So STI and HIV screening and pregnancy testing are widely available, and they are, and while PrEP and PEP and HPV vaccine have lower coverage, highlighting areas for improvement as well. So we see that there's a lower increase in this. So and there's an increase in terms of HPV and pregnancy testing, which is a good sign as well. So, but I just wanted to point out for folks that doesn't know this. So this the PrEP and the PEP is a kind of vaccinations that are needed. That's kind of PrEP vaccination that are needed for HIV exposure. So this is what we mean by the PrEP, and it's a type of test that does in the health centers. So let's look at these sexually transmitted infections. I'm not going to dive more deep into this this graph, but I just want to point to us that this graph indicates to us that there are positivity rates. The positivity rate for chlamydia, which is this one, declined. You can see it declined between 2022 and 2023. There's a decline here, which is really good. And the positivity rate for HIV, as we can see here, also remained stable the last decade. So which is a little bit slight increase in 2022 and 2023. So let's say a little bit about 0.3 or 0.1 to 0.3% increase. And also, but we can see that syphilis rate nationwide has a kind of increase. The rates for syphilis has a steady increase so far within this period. And also, but the good news here is that there's a decrease, and there's a decrease of syphilis within 2022 and 2023. There's a slight decrease here, so which is also good. So let's also look at cervical cancer screening. Cervical cancer screening, the key trends that we identified on this survey is that 85% of pap tests were normal. So pap test is a type of screening that we use to detect cervical cancers. So, and the ASU, which stands for atypical squamous cells of undetermined significance, So this test and the LSU, which also stands for low-grade squamous lesion, this test has a most common abnormalities, as we can see on this graph as well. So the pie chart here, this pie chart shows us that the majority of pap test results in 2023 were normal. So 85%, which is here, 85% of this test were normal. So the most common abnormalities that we can see here are this ASU and the LSIL, which are the abnormalities that we detect within this test. So let's also look at the bar chart. So based on the bar chart here, we can see this illustrates that there are 22% decline in the total number of pap tests from availability or patients engagement. So there's about 22% decline, which is really good in the area of a public health standpoint. So let's also look at the trends that we can find in the challenges in the EHR data collection. Let's talk a little bit on that challenges. So when we say challenges in EHR data collection, like here, I work in the health services center here. We collect a lot of data using the EHR. So the key trends that to note here is that there are only 24, based on the institutions that participated in this report, about 28% of institutions run reports on gender identity, despite having capability of doing so. So there are barriers that we noticed within that report. So that barriers are based on, that barriers include lack of standardization, limited resources, and inconsistent usage. So as we can see on the flow chart here, as we can also see on these flow charts, it illustrates that the process of EHR data collection, many institutions have the capability to disaggregate data, which is collect data based on sex, age, and gender identity, but they lack standardization. They lack standardization, limited resources, and inconsistent reporting. So what do I mean by that? Lack of standardization, I mean that different institutions may use very data formats and reporting methods, making it hard to consolidate and compare data consistently. So also limited resources that that is, institution may not have, most institutions, even our own institution, will not have enough staff or the time or the funding to focus on effective data collection and analysis. So that is why we have these challenges on collecting data based on collecting data based on data disaggregation. That is collecting disaggregated data. But I hope with time we will get over it. So, but these are the findings that we got based on this report, this study. So what are our actionable recommendations for equity? So we can see that disaggregate data by race, gender identity, sexual orientation, and sexual orientation are very important. And also, we should also know that there is a need for us or institutions to increase PrEP and PEP and HPV vaccines, as we can see on our findings on the trends that we just saw earlier. There are needs for us to increase those vaccinations, and also implement trauma-informed and gender-affirming care, and also advocate for equitable sexual and reproductive health care. So if we look at the right side, on our right side here, we can see that this is a heat map showing us disparities in services. in services provision across regions, different regions. So the Northeast, as we can see here, the Northeast region, they leads in PrEP and HPV vaccinations, while the South and the West lag behind. So pointing to regional gaps in sexual health services and access. So these areas are leading in the area of PrEP and HPV vaccination, which is very good. So the West and the South regions are kind of lacking behind. So we can see what data can actually show us, and also having disaggregated data can help us to make and informed decisions, help us to understand where we are lacking and where we need to improve in our data collection in terms of health services to different populations. And which is also why it is important for us to collect disaggregated data, which is based on sex, age, gender, although many institutions have those capabilities, but they're not doing it. So we saw that with this survey as well. So key takeaway from this report is that data disaggregation is what is crucial for identifying health inequalities. So positive trends highlight successes, while gaps show areas for improvement. Actionable steps to promote equity and better health outcomes are needed. So we should work towards that. Every institution, starting from our own institution, actually. So this is actually what we studied or we picked from this survey. And this very year, 2025, we're also participating on another survey, ACHA survey with other institutions. Hopefully we can have more institutions, more than 150 that participated in this very one, in this very year. And we will have more trends and also more informed decision that will help our institution as well. So this is, if you have any question, you can ask. Thank you. Thank you all.
Thank you, John. Anyone have any questions? Well, I have one. So with the recent, let's say, executive orders that have come through, how have they affected how you're going to be disaggregating data going forward?
Okay, great. Good question. So with that, so recommend like we pointed out on these recommendations here. So we plan on having more disaggregated data, collecting more disaggregated data. That is what we recommend to every institutions, to collect more disaggregated data, which in terms of collecting data based on gender, identity, based on sexual orientation. And if we collect data in this form or in these areas, we will be able to identify the needs or be able to pinpoint areas that we are lacking in our studies, areas that need more touch in our health services. Because when we don't collect disaggregated data, we will be lacking the ability to identify groups that are most vulnerable. So we can underrepresent some groups in the health services, so which is very bad. For instance, we might not know the populations that are having more impact in HIV or in PrEP or in STI infections, because we are not collecting our data in a proper way. So we don't know if this population may be females or the male, or which other populations that are having issues are more affected in a certain way, because we don't collect those data. So we might misinform or give a wrong impression of what is actually going on, because we have we have, let's say, bad data collection, or we lack some ability of collecting aggregated data. So we also need to work on implementing trauma-informed gender-affirming cares in our health system. So which will help us to that is like this is when we care for students or care for individuals, we should make sure that we enter the data in the system that okay, these are females or males, or this is in this group or that group. So entering our data those ways will help us to identify the populations that are actually having issues in our health systems. So I don't know if that answered your question.
Yeah,
Thank you.
thank you. All right, I want to say thank you so much for all who came to join us today. Happy Love Data Week, and we hope to see you at future sessions. Thank you so much. Bye-bye.